Good afternoon. Welcome to the kickoff meeting for the Social Work Compact hosted by the Council of State Governments and made possible by a cooperative agreement with the Department of Defense. I'm Keith Buckout. I'm a research associate for CSG, and joining me from CSG are Deputy Director of the Center of Innovation, Heather Schaefer, the Director of the National Center for Interstate Compacts, Dan Logsdon, and our Project Manager, Matt Schaefer. I just want to do a bit of housekeeping before we get started. Closed captioning is available, and if you have technical difficulties or have a question about Zoom, please send an email to registration@csg.org, and CSG staff will respond as soon as possible. You can also use the chat feature to submit questions about technical difficulties, but to ensure that the chat feature does not distract from the speakers or the presentation, please only use the chat for requests for technical assistance. Also, to ensure our speakers can be heard clearly, all participants will be muted during the meeting. Further, the session is being recorded, so by continuing to participate, you are consenting to this recording. The recording will be available to view on our website in the coming days at compacts.csg.org. After our speakers and presentation, there will be a question and answer session. Questions were submitted prior to the meeting via email, and we will do our best to answer as many of those questions as possible. Due to the limited meeting capacity, we can't guarantee that you will be able to rejoin the meeting if you leave. If you have to leave the meeting and are unable to rejoin, please watch the live meeting stream on our Facebook page, and that's www.facebook.com/CSGOVTS. That's facebook.com/CSGOVTS. With that out of the way, it is my pleasure to introduce the Deputy Director of the Center of Innovation at the Council of State Governments, Heather Schaefer.
Thank you, Keith. We are so excited to be with you today. There are many people from many organizations who have heard you and worked over many years to bring us to today, where we are kicking off development of an occupational licensing compact for the social work profession. And we at CSG are so grateful for the opportunity to support you and the social work profession in this work. To start, would love to tell you a little bit about CSG, the Council of State Governments. We were founded in 1933 as the nation's only organization serving all three branches of state government. As an organization created by the states to serve the states, we have this unique privilege to convene state leaders and stakeholders like yourselves to develop and share best practices and policy solutions. Today, you'll be hearing from our team at the CSG National Center for Interstate Compact, which has been supporting states for decades around development and implementation of compacts. The team at the National Center for Interstate Compacts, which I'll refer to as NCIC, will be leading the work of developing the compact for the social work profession. These interstate occupational licensure compacts provide an effective means for achieving borderless practice for licensed practitioners, including military spouses, by relieving the burdens of maintaining multiple state licenses. This burden of holding multiple state licenses is especially burdensome for military spouses, which is why we have our partners at the Department of Defense interested in supporting this effort. But they are also very much committed to making sure that this effort benefits not just military families, but the profession as a whole. Specific to military families and the unique impact that they have on some of these occupational licensing matters across states is that military families on average move every 3 years. Military spouses are at times carrying 4 to 5 licenses. Tracking these requirements is burdensome. And states are working hard and are very interested and committed to streamlining and expediting licensure for military spouses. Military spouses also need the ability to remain in the marketplace regardless of their destination. And licensure compacts can provide that regulatory certainty for those military families. All of the existing occupational licensure compacts that have been implemented to date contain provisions developed in collaboration with the Department of Defense that allow military spouses the ability to continue to work regardless of the state where they move. So we are so grateful to our partners at the Department of Defense for working closely with Congress to secure funding to create a social work occupational licensure compact that will not only benefit military spouses, but all practitioners in this profession. I would like to take this moment to welcome our partners from the Department of Defense, because again, without their support, this project would not be possible. So I am honored to welcome Mr. Joe Ludovici, who is the Principal Director for Military Community and Family Policy, and the Director of the Department of Defense State Liaison Office, Marcus Beauregard. Thank you for joining us and for DoD's support of this very important work. And I will now turn it over to Mr. Joe Ludovici or Mr. Marcus Beauregard, whoever would like to make some comments first.
Unfortunately, I think Mr. Ludovici and Mr. Beauregard are having some technical difficulties signing on. Thank you for those comments, Heather. Hopefully we'll be joined by our partners from the Department of Defense soon, and we look forward to getting to their comments when we can get those technical issues worked out. So for the time being, we'll jump to welcoming our partners in the social work profession and give them the opportunity to provide their perspectives on license portability and interstate compacts. Joining us today are Dwight Hymans, the CEO of the Association of Social Work Boards, Dr. Kendra Roberson, President of the Clinical Social Work Association, and Dr. Angelo McLean, CEO of the National Association of Social Workers. Mr. Hymans will go first, followed by Dr. Roberson and Dr. McLean. And so without further ado, please go ahead, Mr. Hymans.
Thank you, Keith. I'm so pleased to speak on behalf of the Association of Social Work Boards, its board of directors, and the 54 U.S. regulatory members that are a part of our association. And for those that don't know, ASWB also includes as members the 10 Canadian provincial social work regulatory associations and colleges. We also would like to thank the Department of Defense for funding this really important initiative. And of course, we need to thank the Council of State Governments and its Center for Interstate Compacts for providing the technical expertise and facilitating the development of a model compact for the social work profession. ASWB is really pleased to be honored to be selected as the lead organization for the process. Social work regulators have been working intentionally since 2013 to increase practice mobility for social workers, including military service members, their spouses, and veterans. We know that mobility is important to military spouses. And we have hosted a website for many years now around mobility called movingsocialwork.org. And I'd like to read a testimony from that website from a military spouse who posted somewhat of her thoughts and experience in regard to mobility. Here's what she has to say. Military spouses would like to continue utilizing our professional social work skills when relocating. We love our profession, and we do not want our transition to a new state to delay our ability to offer our services. Licensure portability would not only improve morale, reduce stress and financial burden, but it would secure the careers of so many military spouse social workers. I think that's a nice example of what this is all about. Over the years, ASWB has collaborated with many stakeholders to develop a mobility strategy. In 2017, social work regulators adopted what we referred to as an endorsement model, which encourages states to recognize a social worker's existing license in issuing a new one. And since 2017, nearly half of ASWB's US member jurisdictions have adopted licensure by endorsement or reciprocity provisions. This groundwork has laid a solid foundation for adding compacts as another mobility tool. Even before social work regulators started working on a mobility strategy, though, we had already built a strong framework for mobility with the licensing exams. Social work regulatory boards formed ASWB in 1979 with the purpose of and mission of developing and administering a national exam that all member boards could rely on as they approved applicants for licensure. The exams really, in many respects, were the first mobility tool for social workers and regulatory boards. The COVID pandemic certainly has re-emphasized the need for a uniform approach to licensure that compacts offer. Compacts will strengthen the mobility structure for the profession. And I think the goal of developing a model compact will offer increased mobility for individual social workers, the military, regulators, and consumers in ways that ensure that the public is protected, which is the primary purpose of regulating the profession. So we thank you all for attending this information session. It's obvious there's a strong amount of interest, and as demonstrated by the attendance, a strong amount of interest for some solution to this issue. And we certainly look forward to working with the Center for Interstate Compacts and the Department of Defense to increase mobility for the military and for the entire profession. ASWB is excited to be a part of this, this project. So thank you, and I'll turn it back to you, Keith.
Thank you so much, Mr. Hymans. We appreciate those comments. Dr. Roberson, if you'd like to go next.
Thank you so much. I'm just so excited to be here, and I really want to thank you all so much for this opportunity to be a part of this project. The Clinical Social Work Association strongly supports the development of a compact for clinical social workers for all of those reasons that Mr. Hyman just noted. We represent many of the over 250,000 licensed clinical social workers in the country. We've been hearing for several years about the difficulties that LCSWs have in moving a license from state to state. A major part of this problem could be eliminated if there was a floor that states could agree to so that licenses could be transferred more easily. In addition to supporting LCSWs who are active military or spouses of active military personnel, there are also numerous clinical social workers like myself who've moved to other states within the private sector and need this reciprocity and this kind of compact to lessen the burden of doing so. The time it's taken for me to move my license from Washington to Texas to Georgia, it's been onerous, honestly. I hope this compact will enable others to avoid the time and stress that moving a clinical social work license entails. Thanks again to the Department of Defense and the Council of State Governments, and for all of our partners in social work, ASWB and NASW. We're just looking forward to a wonderful conclusion of this process and this ability to help clinical social workers not have to disrupt their practice.
Thank you for sharing that perspective, Dr. Roberson. We appreciate those comments. Dr. McLean, if you would go next, please.
Thank you, Keith. And thanks for allowing me to make a few remarks today. Just really excited, as my colleagues are, to be a part of this initiative, to working on the first ever interstate compact for social work licensure. It's exciting, and as Dwight described, ASWB for a number of years has really been taking a lead on working on mobility, and we've been there every step of the way supporting ASWB in that effort. And between ASWB, NESW, and the Clinical Social Work Association, we've collaborated on a number of projects. One of the most notable was, we created standards for technology standards several years ago. So you've got a team of people who are ready and willing to go. And then in addition to that, we've got our 55 chapters, and they're excited about this initiative. And our chapters, a significant portion of what they do in their advocacy for social workers is working on licensure issues. We saw that during the pandemic as they kicked into gear to ensure that we had the greatest degree of flexibility around telehealth and audio only, to where social workers could continue doing their job. And social workers rely on what we think of as telehealth or teletherapy, and sometimes we call it telesocial work, because we've got social workers in child welfare, social workers in case management who use that tool as well. So, having this framework will be really, really powerful. Really do want to thank the Department of Defense, really recognizing the need for the compact, and then, their generosity in really funding the first year of this project. And it's going to really help the 750,000 social workers across this country who are the primary providers, and I should probably say the biggest providers of providing mental health and social care services across the country. And social workers have always been essential workers, but we've seen that even more through COVID. And I often say, issues like child welfare, mental health, hospital social work, school social work, I could go down the list, don't take a holiday. So when others might be hunkering down, and, social workers are still there on the front line delivering. So I do want to give a shout out to all the social workers on the line today. Thank you for what you've been doing over the last, I want to say 15 months, but even before then, of really, standing up and doing those things. It's really been appreciated, and it's been noticed. I was teasing some folks, a year ago, we were saying, why aren't we getting the same kind of love and affection that the nurses and the first responders are getting? And there was a lot of advocacy around that, but come time for deciding who was in the priority for the vaccines, social workers were right there at the top of folks who were saying, yeah, we got to make sure that the social work workforce is in line early. But having the compact is going to be crucial to being able to provide services going forward. We know telehealth is here to stay, and we know that an interstate compact will help provide a policy framework for that. I know Dwight and his friends at ASWB are really looking forward to taking the work that they've done on establishing the model licensing law and being able to fold those elements into the compact. So I want to thank the Department of Defense, the Council of State Governments, and I did a lot of work with the Council of State Governments on the child welfare side when I was a commissioner, and just really appreciate the work that you guys do, and the chance to be able to work with the Center for Interstate Compact. I may not have gotten that right, but looking forward to working with you guys, Heather and Keith and company. And with that, I'll send it back to you, Keith.
Thank you so much, Dr. McLean. We really appreciate your insight and for sharing about the experience of social workers, especially during the pandemic. That's so important. I'd also just like to thank the three of you so much for sharing your expertise and for taking the time today to address our meeting. I am told that our partners at the Department of Defense have, we've been able to resolve those tech issues. So hopefully we can hear from them at this time. I'm told, Marcus Beauregard, you have been able to join the meeting. And so Marcus, if you would like to take time to share DoD's perspective on this project and the work, we would really appreciate it.
I'd love to. I don't think Mr. Ludovici has had an opportunity to join us, and so I'll try to cover what he would have as well. Yeah, it was just interesting trying to get in on this call. I don't know if any of you ever tried to actually type in a Zoom call address. That's what I was attempting to do, and that didn't work out. But so I'm just happy that I finally got here. The department's very, very appreciative of the opportunity to work with the social work community. The social work community is part of the Department of Defense in terms of we employ a lot of your practitioners, either in the clinical or non-clinical formats. We have non-medical care providers on all our installations and in many of our schools. And it is an essential part of providing for our military families. I think you had an opportunity to hear from Ann Kramer. Hopefully you did. And she was able to tell you about her experience as a military spouse. I'm just sad that I didn't have an opportunity to hear her talk as well. I won't cover that aspect of it, because if she has already, it would be redundant for me to talk about it, and I don't think I could do as good a job. But I can say from the department standpoint that supporting military spouses is essential to taking care of our families, and that taking care of our families is essential to maintaining the retention of our force, and retaining the retention of our force is essential for military readiness. And so we have this straight line between taking care of the careers of our military spouses and readiness of our force, because if we can't keep our qualified people working in the department, readiness definitely goes down. I've had the opportunity to work in licensure for about 9 years, and I've seen that of all the options we have for taking care of the military spouse license portability requirements, compacts cover it better than anything else. And so we look forward to having this opportunity for military spouses who are social workers. And I'll just say one other thing, that the Congress gave us this opportunity to work with professions because they also get it. They get the concept. They understand how beneficial compacts can be in terms of the mobility of military spouses. And I think they also get it in terms of just all other practitioners, in terms of giving them the capability of providing their practice across state lines and providing their services, very necessary services, to the American public. So thank you all for committing to this process, because it is definitely important. Thank you.
Thank you so much, Marcus. Okay. Well, thank you so much, Marcus. We really appreciate those comments, and we so appreciate your support in this project. We quite literally could not do this without the support from DoD. And also, I think I have great news for you, because you did not miss comments from Ruth Ann Kramer. And so now we're going to hear from her. We're joined today by, I believe she prefers Ann Kramer, and she is a licensed clinical social worker in Hawaii who is also a military spouse. I'm told she is also preparing to move to Virginia, so she will have to be transferring her license. And so to provide additional perspective on licensing and the need for license portability for social workers in the military community, we're joined today by Ann Kramer. Thank you so much for joining us today, Ann.
Thanks for having me and allowing me the opportunity to just share a piece of the struggle that I've experienced. And it's probably very similar to many stories that you've heard from spouses. But yes, I'm calling in from the Aloha state of Hawaii. Unfortunately, I'm going to be leaving, but I'm going to be going to the great state of Virginia here in a couple of weeks. The state of Virginia does have license by endorsement, but what they require me to do is to get a license verification for every license and certification that I've ever held, which in the past 7 years is a total of 5. And one of them is the DC license that I closed out in 2015. So to go back and get a verification for a license that I haven't used over the past 6 years seems a bit redundant. So what I have to do is wait for all of these verifications to come back to me before I can even submit my application for a license. So that's very frustrating when you're trying to get ready to move and also look for follow-on employment. What I would like to say is that in this compact, if you're able to somehow include a supervisory status, because being able to be a supervisor for all of the social workers working on their licenses is extremely vital to develop our LCSWs. So if at some point in that pact, we could include a way to have the supervisor status transferred as well, because every state has their own class, their own certifications for you to be able to be a supervisor. And we need those people to do the supervisor licensing hours So it's extremely important. And if we could have one list of all of those supervisors so that it's easy for military spouses and all other people in the civilian sector to be able to access that list, that'd be very helpful, because people ask me to supervise them from here and then I'm moving, but if we could continue that, that would take away a barrier. And then lastly, if it possible, we could add the substance abuse certification. I work in the substance abuse field with chemical dependency, and that's needed everywhere. And that's another barrier, is you need that local certification to also practice in that specific field. So in the future, if we could look at learn how to add the SUD certifications as well. But that's all I have. Thanks everyone for your great efforts in making this come a reality.
Thank you so much. We appreciate those comments, and thank you for joining us and for sharing your experience. To keep things moving along, we're going to jump straight into the next agenda item. The director of CSG's National Center for Interstate Compacts, Dan Logsdon, and project manager Matt Schaefer are going to give an overview of the basics of interstate compacts and the development process. After the presentation, we'll begin our Q&A session. Those were emailed prior to the meeting today, so please stick around for that. Dan and Matt, we're all here to learn about interstate compacts and how a compact for social workers will be developed. So I'm going to get out of the way, and so everyone can hear from the experts. Thanks, guys.
Thanks, Keith. Welcome, everybody. So we're going to, because we had so many participants and we got so many questions when we solicited them earlier this week, we're going to actually stay on longer to answer some of those questions. So if you would like to stick around, we're probably going to stick around another 15 minutes. Just want to be as accommodating to everyone as possible. And again, appreciate everyone joining today. Just briefly want to go through what an interstate compact is and kind of reset. Let's go on to the first slide, please. The next slide, please. And just say before I get into some of this that really appreciate Congress and the DoD support. Congress has been very generous with their approach to this. Obviously, doing something for military spouses is what punched our ticket to participate in this and to get this cooperative agreement. But they were generous enough to say, don't limit yourself to that. If you can create something that benefits the profession at large, please engage in that as well. That's within the mission of what we're charging you to do. So that's why this is a tremendous benefit for all these professions. We're happy to be working with the social work profession. So an interstate compact is just a contract between and among states. They can be bilateral, they can be regional, they can be national. They've been around since before the founding of the Republic. There was a compacts clause in the Articles of Confederation. There's a compacts clause in the U.S. Constitution. In the 20th century, you saw the rise of these administrative compacts, which gets us into the 21st century with these licensure compacts. So who knows what states will be using interstate compacts for predominantly in 20 years. But right now it's to look at portability and reciprocity for occupational licensure. And you all have an example of an occupational, or excuse me, of a compact near you, either on you or close to you probably now, and that's your driver's license. The federal government didn't pass a law and say the states had to allow folks from other states to drive in their state, and that they had to recognize those licenses. The states got together and worked that out for themselves. And compacts are a manifestation of our unique federalist system of government. I know it can be frustrating at times, but that's the way the founding generation set it up, is that states have responsibilities designated to them. Certainly at any time, the federal government can take those away, but typically they like to let the states try to work something out for themselves before they get involved. And so, again, they've been very interested in occupational licensure for a long time. With hope that interest will wane once they see states taking some concrete actions, especially on the portability and reciprocity front. So it maintains state sovereignty, and that's why we believe states like it. That's why CSG likes compacts generally in these licensure compacts so much. And they do give states the flexibility to respond to issues again, either bilaterally, regionally, or nationally, and, take their own unique set of circumstances into account. When Congress passes a bill, they can't possibly account for the vagaries of what every state is experiencing. It wouldn't be fair to expect them to, but if the states are around the table, they can typically do that. Let's go to the next slide. And again, for these licensure compacts, they serve a terrific function for allowing portability and reciprocity. They facilitate multi-state practice. They allow states to retain control over, the health and safety and public protection aspects of it. And then again, they preserve the state sovereignty and authority. So the way all these licensure compacts work is whether you're using a multi-state license like the nurses, or a privilege to practice like physical therapy and some other compacts, if you're in a state practicing, you're under that state's regulatory authority, and you have to abide by their Practice Act. So states like them because they can facilitate interstate practice for certain professions. We don't believe these are appropriate for every profession, but then the state retains control inside their borders on what the scope of practice is. And you've seen this as an idea that states are adopting. This slide's not that old, and it's already out of date because a lot of governors are signing bills right now. Just earlier this week, Governor Hogan signed the compact for counselors and the compact for speech pathologists and audiologists. So these numbers will tick up a little bit, but 44 states have adopted at least one, 28 states have adopted at least 3 of these licensure compacts. 9 of them exist and are out for the states to consider. 149 separate pieces of compact legislation has been passed by states since 2016. I think that's probably over 150 now. And then again, we have 9 professions that have these, plus the professions that we're working with a part of the DoD project. And then the physician's assistants are also pursuing an interstate compact. Let's go to the next slide. And here we are. So these are the 9 that exist. Nursing, physical therapy, medical. The nursing compact is in its 2nd iteration. You've got the EMS compact. That's for EMS personnel during non-gubernatorial declared disasters. When the governor declares a disaster, another interstate compact kicks in. That's the Emergency Management Assistance Compact, which is actually housed at CSG. The psychology compact, audiology and speech language pathology, OT and counseling, we just sent to the states this year. And then advanced practice nursing is also out to the states for their consideration. And again, I think for speech pathology and audiology and counseling, you can add 1 state to them. So again, health and allied health, you've seen states respond to that. We're also, as part of our DoD contract, working on compacts for cosmetology and teaching. So those will be the first 2 outside the health and allied health sphere. But in that sphere, we've got obviously social work, we've got dentistry, and then we've also added massage therapy to the mix that we'll be working on. So let's go to the next slide. And so there's the ones that we'll be working on. And then again, the Federation of State Medical Boards are working to create an interstate compact for physician's assistants. CSG is an advisor to them on that project. We have been either an advisor or facilitated the effort to create all the existing licensure compacts. And we have a lot of expertise in this area. We just ask you to be patient and trust the process. It's a long process. It's a complicated process. But again, we believe that this profession is certainly well suited for an interstate compact. And we believe we've got a great team assembled to go about that work. So let's go to the next slide. All right, and we can, this slide, sorry, is also out of date. Georgia now is a member of 8 of these licensure compacts. So we'll work on this heat map before our next round of webinars. But again, you just see more and more states adopting these and responding to this idea of these licensure compacts. And that's mostly because, 1, they work. They've been tested and tried over time. The nursing compact is in its 2nd iteration. It's over 20 years old that the nursing profession has been in this space. And you're seeing other professions obviously take this up. Largely because, as much as state boards do their best to try to address this issue, it's really difficult to expect them in some sort of loose coalition to get that done. I mean, what we've discovered with these other professions, that what's helpful to them is some sort of binding statute, a binding contract, with other member states, because, I get appointed to be the new chair or the new executive director of a state board in a state. And, there may be things that I feel strongly about that I want to implement. And yes, that might take me afield of what the last executive director or chair agreed to, but I've got to make that job my own. So, and legislatures, as much as they try, sometimes they get in the way of what state boards are trying to do. And so with a compact, you really relieve a lot of the ambiguity around reciprocity and portability. You preserve a board's ability to enforce the provisions of their Practice Act and to take action to protect the public, which is why they exist. And you give practitioners some regulatory certainty. So for those reasons, we believe that they're an idea that's time has come and that states are responding to. So let's go to the next slide. And then, so the benefits for practitioners, we are in an increasingly mobile world. And so, they do address increased mobility. I think for this profession, especially in light of the pandemic, you're going to see telepractice play a larger role in health service as we move forward. So we can address that in the licensure compact. And then again, the one requirement we have, which all the compacts that exist for licensure do this already, is address and support military families. Military families move on average every 3 years. And as Heather noted, sometimes you've got practitioners carrying multiple licenses, and that can be quite burdensome. So we want to make sure that folks that are sacrificing to serve the country get the benefits of these mechanisms. And again, all the existing licensure compacts, either in rule or in the document, address support for military families. Let's go to the next slide. And all right, so and then the benefits for a licensing board, again, they get an agreement on uniform licensure requirements. Now, sometimes those are spelled out in the agreement, a la the nursing compact or the speech pathology and audiology compact. And sometimes states exclusively rely on the home state license. So, again, we'll work through all these issues with the project team about, and both the advisory group or the technical assistance group, and then the document team that'll actually write the compact. But, this agreement on a uniform set of requirements give boards the confidence and give them the peace of mind that, they're not going to have people coming into their state that aren't qualified to participate. But, there's got to be give and take. And then the shared data system, all these licensure compacts have a compact commission. All modern interstate compacts have a compact commission, and that data system is a key component of that. And then again, we believe that it's not a silver bullet, it's not a panacea, but compacts can address issues around access to care. So let's go to the next slide. All right, and then generally for states, the benefits are protecting state sovereignty, enhancing cooperation among states. States are always looking for forums. And that's one of the things that we do at CSG. So you're seeing these licensure compacts really become forums for the professions that have them, and that's a good thing. And again, we've talked about strengthening labor markets. You're seeing states pass some of these universal licensure laws now, and that's fine. States can, as a membership organization for states, we endorse that action, but we want to make clear that they understand that, universal licensure laws and interstate compacts aren't mutually exclusive. You can have them both. A universal licensure law is terrific for folks that want to come into your state. It doesn't really benefit practitioners in that state, whereas a compact, if it's enacted, allows for practice, out of the state, and obviously opens up markets for practitioners. So let's go on to the next slide. Okay, so we're not going to go through this slide. But CSG, is almost 100 years old, and we've been working on interstate compacts since we were founded. And this is kind of a distillation of how we create interstate compacts. So most of our work for this project will be in phase 1 and a little bit into phase 2. But, you can rest assured that this isn't going to be a group of people in a room somewhere that writes something and then takes it out to the states and tries to get it enacted. It won't work that way. States expect this to be vetted. States expect it to be a transparent process, and we insist upon that. I get plenty of folks that approach me from certain professions that say, we'd like to hire you all to create an interstate compact, and what they mean is they want access to our legal team so that they can just sit down at the desk and write one out and take it out to the states. And we That's not how we do this. Interstate compacts, a quirk about them is, obviously they're a contract. So every state has to pass substantively the same language, and they can't be changed when they get to the legislative portion of this substantively. And so, legislators expect that we're going to do a lot of vetting of this document. So when we tell them you can't change this or you can't change that, they understand that those provisions have been vetted and they've been considered. So that's all I want. I just wanted to kind of give you a visualization of how we go about creating these things. So let's go to the next slide. All right, and with that, I'm going to turn it over to my colleague, Matt Schaefer. Again, we're going to start answering questions after Matt's presentation, and we're going to go about 15, 20 minutes into the next hour. So if you can stick around, great. If you can't, apologies, but check out our website. We'll be posting answers there to general questions, and then you all have the email address. If there's something that you have a burning desire to hear about, you can certainly email us and we'll respond as quickly as possible. Again, thanks for attending today.
Thank you, Dan. And just to reiterate what's been said already, there will be a recording of this webinar. So if you're not able to stick around for the Q&A, you'll be able to access the recording on our website. That's compacts.csg.org. Wanted to just add on to what Dan shared and provide a little bit of context of why CSG and the Department of Defense think that social work is a good fit and why is now the right time to pursue something like this. Just wanted to say initially that this was a competitive application process that ASWB, CSWA, and NASW responded to. There was a number of great professions that applied, but ultimately these organizations made a very strong case that social work should be selected. And so here we have listed just some of the key components that CSG considered when looking at these proposals. And the first is size. We really wanted to prioritize larger professions where there was a significant number of military spouses who would benefit from this portability option. And so ASWB cited in their application approximately 498,071 licensed social workers. I think Dr. McLean earlier in his comments said 700,000 social workers. So this is one of the largest professions in the country, and an interstate compact will surely have a huge impact on portability, and it's an opportunity that CSG really couldn't pass up. The second is sustainability. So CSG's role in compact development is to help the profession develop the model legislation, but it's the profession's job to take that model legislation and actually go out and get it enacted, set up the shared data system that Dan mentioned, set up the Interstate Commission. And so CSG saw from these three organizations a real commitment, and that they have the available resources to be able to sustain this effort in the long term. And then lastly, buy-in. It was really positive that CSG saw three large membership associations apply on behalf of the profession. So it really just shows that the profession is ready to take this step in developing an interstate compact for the profession. On the next slide, I wanted to just share a little bit about timelines. So Dan had that slide up that had all the information about our development process. So one of the most popular questions that we received when we solicited questions for our Q&A portion is, what's the timeline? When can I expect to be able to practice in multiple states? And I just want to emphasize that this is a longer term process than just signing a bill one legislative session, but this takes years of development, but the result is something that is lasting within the profession. So you can see here from the gold star where we're at currently in the kickoff meeting. Like I just mentioned, this was a competitive application process, so we released the RFP. There was a deadline, and then we announced the selected professions this March. The next step will be to convene what is called the Compact Technical Assistance Group. This is a group that is being developed that will have approximately 20 stakeholders from within the profession that will come together and come to a consensus on a set of recommendations that will then be handed off to the compact drafting team. And so the drafting team will take the recommendations from the technical assistance group, and what they're going to do is actually sit down and write the model compact legislation based off of the recommendations from the technical assistance group. The next step is when we hold a stakeholder review process, where a lot of people in this meeting will be able to review the model compact legislation, provide their feedback. CSG collects all of that feedback and will then share it with the document team and with the technical assistance group. And there will come to a consensus on the finalized language based off of the feedback from the stakeholder review process. And that's when we have that final compact legislation. And then the next step is when it goes out for state enactment. So all in all, we anticipate that the process will take about 12 to 14 months from start to finish in terms of when the technical assistance group meets to when we have a model compact legislation. But there's some things that can come up that can make that process a little bit longer, but we anticipate it being a little over a year, and then it will go out to the states, and it'll be up to the states to enact the compact. So that's all I wanted to share about timeline. I know we are running up on our time, so I wanted to just jump straight into the Q&A portion. I just thank everyone for your time and for submitting very thoughtful questions, and hope that we provide you all of the answers that you're looking for. So with that, I will hand it back over to Keith.
Thanks so much, Matt. I appreciate it. And so thanks to Dan. We are going to jump straight into the questions. These were all submitted via email before we started today. And so I'm just going to go with our first question here. The first question: Washington State requires 3 years of postgraduate supervised experience, whereas many jurisdictions only require 2. Our advanced social work license requires 2 years, but does not permit independent clinical practice. What would prevent someone from intentionally seeking licensure in another jurisdiction to bypass the additional year of supervision?
Yeah, so the way that the licensure compacts tend to work is, or the way the ones that exist currently work, is, everything is tied to your home state. And the reason for that is discipline. What legislators have told us over the years is that they don't want their boards incurring a lot of expense, having to travel all over the country trying to find you. Also, with the requirements in the compact, you have to come from another compact member state. So I'll give you an example of that. So let's say Kentucky, where I'm at, if you can't tell by my accent, is a member of the compact, that I'm using it to practice in Ohio. Okay, well, that's how it's supposed to work. If we opened it up beyond that and someone from Missouri came to Kentucky and got a license, and so that they could get access to the compact, and now they're practicing in Ohio, and for whatever reason they run afoul of the board there, and the board needs to discipline them under the compact, Kentucky is required to assist with that investigation and assist Ohio with carrying out that investigation. So, that might be something as simple as, issuing a subpoena. But, if I live in Missouri, all Kentucky knows is that, he actually lives in Missouri, because that's where his address is on his license. You'll need to go find him there. The Missouri board has absolutely no obligation to assist Ohio in that investigation. Now, boards typically try to help each other, and so I'm sure Missouri would make their best effort. But again, they're not required to do that. And at some point, if those things start happening regularly, I think you'd see Missouri say, hey, we didn't join the compact, and we didn't join it for this very reason. So, you're going to have to find another way to serve these subpoenas and get access to this investigative information. So, it's all, again, tied to the ability to protect the public, and the way that we believe that is best served, and we've seen this play out with all the existing licensure compacts, is everything has to be tied to your home state. So if your primary state of residence, and the Compact Commission ultimately will define what that is, but if your primary state of residence, that could be where you pay taxes, or where you vote, it'll be a number of criteria. that state has to join in order for you to be able to participate in the compact. So that's how, I'm not, if your concern is that, folks will, go and look for places where it's easier to get licensed and get a license there to get into the compact, that won't happen because everything has to be tied to that home state. Now, that being said, we'll look at how states are regulating profession. Again, I believe strongly we can find uniformity to create this compact for this profession, but I'm not concerned about, and I don't think you should be either, about instances around where folks are just going to states and getting licensed. Everything will be tied to their home state. We facilitate the process. We don't dictate things to the group, but that will be something we strongly suggest that they do, because I don't think it can sustain itself in the legislature if it's not tied to a home state.
Great, thanks for that, Dan. Moved into our second question. Will current licensed social workers have to sign up for this, or will this automatically go into effect for all currently licensed social workers? Will there be forms to fill out to apply?
Yeah, so one of the reasons that the nursing profession and the National Council of State Boards of Nursing created a Nursing Compact 2.0, if you will, was because of this reason. So there were actually three reasons that sort of drove that. It's my understanding. One of them was, the compact, the initial nurse licensure compact, required everybody to get a compact license, and some people didn't want it, had no intention of ever utilizing it. So with the next iteration of the nursing compact, the current iteration of the nursing compact, they've sort of got a bifurcated system. If you don't want to access the compact, you get a single state license. If you do, you get a multi-state license. And so, I don't think it would be a good practice to require everyone to get the compact license, because again, some professionals won't be interested in it. What you've seen the other professions to do, they mostly utilize this privilege to practice model. Everything's sort of based on your home state license. And so if you want the privilege, you have to take that affirmative step to get it. So I think everyone has kind of learned from the initial nurse licensure compact that, we're going to give folks an option, and that is what we'll encourage the project team to do, is to not dictate that everybody has to get a compact license. And I'd like to believe they'll listen to us. Most of them do. So that'll be advice that we give them.
All right, great. Go straight to our third question. Who will decide what CE credits? Who will decide what continuing education credits will be required?
Yeah, so the way all the current licensure compacts work, except medicine is a different animal altogether. It's expedited licensure. But the way the mutual recognition compacts work is that you're only required to complete the continuing ed requirements for your home state. So whatever those are, that is what you have to complete. And that's, states kind of have to work through that. Some states believe strongly in their continuing ed requirements, but a part of joining the compact is you kind of have to come to it with clean hands and come to it with an understanding that I'm going to have to give a little bit, but here are all the things that I'm going to get. So that'll be something that we work through the project team with. But all the current licensure compacts don't require you to complete continuing ed anywhere but your home state. And then thinking about military spouses, I'm frankly not sure what kind of benefit any practitioner would get if, yes, they can more easily go to another state, but if they have to complete all those requirements still. So again, now where the current licensure compacts, there's a caveat there. If a state has something in its practice act and you're required to complete that requirement, or maybe even complete a continuing ed requirement that's tied to, say, I don't know, supervision, then if it's in the practice act, typically the compact commission comes down on the side of you have to complete that. But again, that's a different thing altogether than the hours that you would have to complete for licensure renewal.
All right, great. Thank you so much. Their next question: will social work look to other professions like nursing for input and guidance? It seems the multi-state license for nurses is what social work would want to adopt.
Yes, I mean, we will, when they created the second iteration of the nursing compact and that took about, I think, 3 years for them to get their arms around it and finally get it written and start down that path. With all the compacts that have come in between, that timeline has become much shorter because we can learn from what other compacts have done. Now, you just can't, and you all know this, you can't just pull the nursing compact off the shelf and everywhere it says nurse, insert social worker. But, we'll borrow heavily in the drafting part of this from the language that the other compacts have used, and we'll tweak it for our purposes. So yes, we will learn from the other compacts, and yes, most of the other mutual recognition compacts, aside from nursing, have chosen to approach this with that privilege to practice model. But I agree with you. I think a multi-state license is a terrific approach, and ultimately the project team will decide how they want to get at this. But we will inform them with lessons from other compacts and probably even presentations from the current existing compacts, so that they can hear firsthand about their experiences.
Great. Thank you, Dan. Our next question: as a licensee, what will be my role and how will I be supported in understanding any given state's unique regulations? Will this be my responsibility or a responsibility shared by me, the compact body, and the employer?
Well, I mean, it's ultimately your responsibility as a practitioner. And states are making that easier and easier to access. The current compacts direct licensees to those resources. There are a couple of compacts that require you, if a state has one, to pass that jurisprudence exam. Those are typically open book. They just want to make sure that you're familiar with their rules and regs. They're not trying to, it's not a hard test to pass, but yeah, ultimately that responsibility is on the practitioner, not to, this example can be carried out to an absurd level, because what you do, what social workers do, is important, and that's the reason that you're regulated, is because this profession, while it brings a great deal of benefit to people, you also have to guard against people that can do harm in this profession. My sister is actually a social worker's aide for the state of Kentucky. With that being said, a good example to think about is, if I'm in another state with my driver's license, because that's a good rubric to always come back to, and in my state I can turn right on red, but in this state they don't allow me. When the police officer pulls me over, he's not really going to listen to that excuse. It's like you have to know the rules of the road here. And so it's the same kind of principle. If you're in that other state, you're under the authority of that board, and you're expected to know how they how they regulate that profession.
Great, thank you, Dan. We received several questions about telehealth, and it's obviously an important topic to address given the pandemic and how important telehealth became during the pandemic. And so our next question is, how can I be licensed in other states as a clinical social worker so that I can be a telehealth provider in addition to in-person practice?
The way the compact, well, in terms of the compact, typically states don't have a separate license for telehealth, and I don't believe they do for social work. Will very likely for this profession, I think it would be prudent that we'll include a section about telehealth. But the PT compact doesn't contain anything about telehealth, and yet you have physical therapists practicing telehealth into states because it's just another modality of practice, and they're using that license. But the compact will be for telehealth and in person. The only true telehealth compact is the psychology interstate compact, SIPAC. With hope you guys can come up with a cool name like SIPAC, but no one else has been able to. But SIPAC even with that being primarily for telehealth, SIPAC has a provision for 30 days in person in a state in case of emergency. So it's all the compacts allow for both telehealth and in-person. As far as how that section will function, obviously that'll be up to the project team, but we're not looking to create, I would encourage the project team to, let's not just do one or the other. Let's make it all encompassing if we can do that.
Okay, great. Thank you, Dan. Our next question is, let's see. Will there be a body that provides some kind of assurance that my license can be used across certain state lines? What does the discipline/investigations process look like with the compact?
Yeah, so that's the function that the Interstate Commission serves. All right, so the Interstate Commission will provide that certainty for you that there'll be a venue for you to go to if you have any issues, but typically you haven't seen that with other professions. If you meet the criteria, you're pretty much given the green light to go to the other states. But yes, that's one of the purposes that the Interstate Commission will serve.
Terrific, thank Dan. And this question may relate to the previous question a bit, but I think it's probably worth addressing as well. I would like to know if there will be an easy to search database that provides verification that a person is entitled to practice.
Yes, all these licensure compacts have robust data systems where the that holds all the licensure information and then the information around either a compact privilege or a multi-state license. Now, depending on how robust it is a challenge because, that's a very expensive effort to create these compact data systems. So, the more functionality you have, obviously, the more expensive it's going to be, but they all have to have the licensure information. They all have to be usable by the state boards in order to facilitate this interstate practice. So, will there be an easy to search mechanism for the public? Yes, to an extent, based on how the states and the Compact Commission ultimately decide to do that. But, again, all we're doing with these licensure compacts, the main thing is that we're facilitating practice in other compact member states without having to go through the full licensure process in those states. The public protection aspects actually grow and get expanded. So yes, you'll be able to know and be able to see if someone is in your state on some sort of multi-state license or privilege to practice. But the way the current licensure compacts that exist work, there's not a high bar for inclusion, but there's a raised bar because again, it is a privilege. It's not the only pathway. We're not going to close off your ability to get a license in another state. So going back to my Kentucky and Ohio example, for whatever reason, if I still wanted to go, even though the compact exists, if I still wanted to go and get a license in Ohio under the other compacts, I can do that. I don't think that would change for this one. Same way with, if I currently have a license in Ohio and, all I'm doing is renewing now and I got it down and so maybe I'm going to wait before I move automatically to the compact, that'll be allowable too. So, it's just a more expedited pathway. And the way the current ones work is if you don't, have a clean license. So if your license has been encumbered or restricted in the previous 2 years, that's how PT, OT, speech, and counseling work. If you've had a restriction in the previous 2 years, you can't get access to the compact until that 2 years passed or until the discipline from that action has lapsed. It's been 2 years since that discipline. You also have to submit to an FBI fingerprint-based criminal background check. So, that could be a complicating factor. We've moved away. The nursing compact, I believe, has a ban on folks that or practitioners that can participate who've had a felony. You've seen state policy move away from that. And so you've seen the compacts move away from that. But again, there's not a high bar, but, legislators feel comfortable with a little bit of an elevated bar. And I think so do the boards, given that you're essentially getting the ability to have, borderless practice or some sort of modified borderless practice.
Great, thank you for that answer, Dan. See our next question here. How does an interstate compact operate differently than licensing by endorsement? Does an interstate compact provide more portability in the sense that I wouldn't have to apply for, maintain, and renew a license in various states and according to each individual state standards?
Yes, I mean, that's the whole principle about these licensure compacts is, they are facilitating a practitioner's ability to practice in other compact member states without having to get licensed in those states. I'm getting a little bit of an echo. That's how they work. And so, and what the states get for that is, they get to, remedy potentially some access to care issues. But then they also get to retain control of the practice in their state. So it's not as if Ohio or Kentucky, as members of my theoretical compact, have to give up their sovereignty and have to give up how they regulate that profession. All they're saying is, okay, I'm going to agree to take licensees from Ohio under the compact, and Ohio is going to agree to take my folks. But once you're here, there's some differences in how we regulate the profession. You have to adapt by those. Also, on investigations, we're going to coordinate. We're going to create a data system because we believe that brings more enhanced ability to regulate the profession, to protect the public. And we're going to cooperate on investigative matters. So, that's to break it down to its most elementary parts, that's all we're trying to accomplish here.
Great, thank you, Dan. And I know that we said we were going to hang around for a few extra minutes today to address as many questions as we could because the presentation ran a little bit long. But just to be respectful for everyone's time this afternoon, we're just about out of time.
Yeah, Keith,
and
I just saw a question that I'd written down that I'd looked at some of that had been sent in earlier. Someone asked about, will states have the option to opt out of a compact? And yes, the way you join an interstate compact, no matter what its subject matter is the legislature has to pass it and the governor has to allow it to become law, either over their signature or, however a governor can allow a bill to become law. Some don't sign it and let it stay on their desk for a certain number of days, but and you leave the exact same way. So if your state decides that it no longer wants to participate in the compact, there's a process by which you can leave the compact. There's also elements in the compact that address disputes and calls for mediation and those types of things. So, and that's informed by, CSG's long experience in these matters. We encourage project teams to include that, and they typically do because it's just best practice language that we've developed over the decades.
Great, thanks, Dan. Well, what I was about to say is I think we're about out of time, and that was our last question. And so we'll just wrap things up. Thanks again to our partners with the Department of Defense, Mr. Marcus Beauregard, and thanks to our partners with the social work organizations, Mr. Dwight Hymans, Dr. Kendra Roberson, Dr. Angelo McLean. Thanks also to Ann Kramer for taking the time. We appreciate everyone's insight and expertise and for sharing their perspectives. Also, thanks to all of you for joining us today and for your time and interest in this project. We hope you found this presentation informative and helpful. If you'd like to review the material presented today or share it with someone who was unable to attend, we'll be posting the recording of today's meeting in the coming days, hopefully by Monday, to our website. That's compacts.csg.org. That's compacts.csg.org. And again, we'll hopefully post that by Monday to that site. Additionally, if you have questions or concerns that weren't addressed by the presentation or the Q&A session, please feel free to send us your question via email to compacts@csg.org. So compacts@csg.org. And we'll respond to those as quickly as possible. Thanks again for joining us. We appreciate the interest and support in this work, and we hope you have a great afternoon.